Wondering what the F has happened to your body and your life? You're in the right place, my friend. Welcome to Season 3 of Transforming 45, where we dive into the incredible stories of how brilliant humans are navigating the midlife squeeze with courage, passion, and a healthy dose of humor. Don't miss out on any of our heart-led episodes. Hit the subscribe button, leave a 5-star review, and if you're inspired, share an episode you love with a friend. It means more to me than I can express that you're choosing to spend time here and sharing our message of midlife revolution. So let's get into it. Hello, and welcome to this week's episode of Transforming 45. I should have hit record a long time ago for this episode. We've just been here chatting about all the things, but this week I am really excited to welcome Amanda Otterman, aka the Menno Health Nurse. Amanda is a registered nurse, certified health coach, and unapologetic menopause advocate who's on a mission to help women feel seen, heard, and supported through the roller coaster of perimenopause and postmenopause. With a powerful blend of clinical expertise and compassionate coaching, she helps women move from confusion to confidence with personalized education, real talk, and zero shame. Amanda, I am so grateful that you are here today. There's so much happening in our space right now. So I'm like, this conversation was perfectly timed, and I am so glad you are here today. Welcome to the show.
Thank you so much for having me. I'm really excited to be here.
All right, so let's start at the beginning. Who are you, and how did life introduce you to this version?
Oh my. Okay. So if I really were to go back from the beginning, it would be about 12 years ago. When I was 33, now I'm 45. I had a condition called adenomyosis in my uterus. Essentially, for the layperson, that is the endometrial lining that starts to grow into the muscle of the uterus. It's a very painful gynecological condition, heavy periods. I was missing work. It was awful. Lucky for me, I had already had 3 children. So the next best course of action for me at that age was to have a hysterectomy. So I had a hysterectomy done. I no longer have a uterus, cervix, or fallopian tubes. They did leave my ovaries intact. However, I was given very little education as to how that actually would affect me in the immediate period following my surgery, and even down the road, what that would be like as I entered perimenopause and into that transition. Thinking back now, or assessing back, I know that I had symptoms immediately after that. And I think I went from doctor back to my gynae to naturopath. And just back then, 12 years ago, nobody was talking about perimenopause or even things that happen to women after they've had a hysterectomy, right? Everyone assumed that if the ovaries were left in, and this is the only thing I was told by my doctor, the ovaries are left in, you should be fine, you should go into menopause naturally. We know 12 years later that that is not necessarily the truth. There's lots of blood loss that the ovary experiences during that type of surgery, and it actually can shorten the life of your ovaries. So in my case, almost immediately I had urinary genitourinary symptoms, so GSM, of menopause. I had the vaginal dryness, the urinary urgency, I had bladder spasms, and no one wanted to even really address that for me. I went through hundreds and hundreds of dollars of moisturizers and things, and it just never felt the same. And then as I got into my late 30s, just some more things about my body started to change, not really understanding what was happening, still in nursing. But the big transition piece for me that started to happen was about 3 years ago. I left frontline nursing to pursue more of a relaxed work-life balance. And I decided that at that time I was going to do my personal training certification. To my surprise, during doing that certification, there are additional certifications that you can look at. And I'm like, menopause. I'm like, really? I was 42 years old. And I looked into the med fit. So it was a perfect fit for me, because not only was it offered as a personal trainer, but the education piece that was offered with it was more from a medical fitness standpoint. So it offered more of a medical piece to it than, say, some of the other traditional coaching certifications would offer. So I got certified through that as a menopause specialist. And then I just continued my learning from there. And then now I am doing coaching for women, but I also have opened up last year. It kind of exploded, is doing more workshops. A lot of family health teams and community agencies within the area that I live in contacted me like as soon as they found out, I guess, that there was somebody around to do this. They're like, hey, like, we know you're a nurse too. Like, this is perfect for what our clinics need. And so now I've been working with some agencies in the community and with family health teams to give education to women, and it's free, which is great, free for them to attend.
Yeah.
And I do different types of menopause workshops. So I offer 6-week workshop classes. I offer like just individual workshops, just overview type of things. I do workshops in libraries. Lots of women are really looking for this information, and they just want to be heard. They want to be validated. They want to feel like, okay, somebody's listening, because I've been trying to figure out what's going on with my body and I don't know what's going on. And like, my doctor's not listening.
Um,
So there's so many things that I have learned over the last even year about what's missing and where the gaps are. And yeah, so now I've decided that I'm actually going to write my exam with the North American Menopause Society and actually get my menopause practitioner. So I'm booked to do that in October. So fingers
Congratulations.
crossed.
Yeah, that is very exciting.
So yeah, yeah, there's the pivot.
Yeah. Yeah. Well, interesting, right? You are coming at it from the healthcare perspective. I am coming at it from education. Your workplace story is my workplace story, but in education,
Mhm.
not in healthcare. And it's so important. And I think that's going to end up being the heart of this conversation is that there's room for all of us because at the end of the day, for those of us who are doing this work, it is the well-being and quality of life for women that is at the core of what we're doing. And so I am so glad that you are out there doing this work. I'm so glad to be able to call you a colleague. And there's a number of things I want to pull out of your story that I want to dig into a little bit more. And I also wanted to share. So this morning I was at the bank and I had an appointment with turned out to be a young man, and we were chatting, and then he brought in his manager, and his manager was like, so tell me about your business. So I started talking to him about it, and he was like, I I need to have this conversation. My partner is going through perimenopause. It's impacting our relationship. I
Oh,
don't know what it feels like. He said, during our prenatal classes, I remember where I had to put on the belly and just sit with it
yeah.
for half an hour, and how that
Mhm.
impacted me and how I understood what's going on with her body.
Mhm.
And now I feel like that kind of transition is happening again, but I don't know what's happening. I don't know that she knows what's happening, and neither of us know how to talk to each other about it.
Yeah.
And it was really powerful for me sitting there. And then this young man also was like asking questions.
Mhm.
And like, he's like, this is so fascinating to me. And he wanted to know more and more and
The men
more.
are interested too.
Absolutely.
And that's why at the beginning of this year, created a masterclass online for men,
Yeah.
right? Because they need the information too. Like, people don't realize how enmeshed like a woman going through menopause,
Yes.
through that transition, is, right? Because think about it. As a woman, you have your reproductive years, right? You're getting
Yeah.
married, you're having babies, you're raising these babies, you're getting a little bit older, and then all of a sudden you hit your face. And these kids are not 5 anymore. They're, 15, 18, and almost 20. Those are my
Oh,
kids.
yeah. Me too. 20 and 18. Yeah.
Yeah, yeah. So you've got these teenagers that are running around driving you nuts. And then you've got parents who are getting sick, aging. I lost my dad 5 years ago. You're kind of sandwiched in between taking care of all of this and taking care of this over here. And I don't know about you, but I only have one other sibling. So to take care of parents, a lot of it falls on me. I'm the
Mhm.
oldest daughter. I'm a nurse, right? So I'm right in there, asking all the questions, going to the appointments, at the bedside. So that's a lot of pressure. And then while all of this stuff is going on, if you have a career, you're advancing in your career, right? Maybe as a teacher, I know you were a teacher, you might be going into like maybe a VP role or a principal role or advancing in the board somewhere. Lots of women are advancing in their careers in their 40s as well. And then at the same time, your body is going to, you're
Yep.
not sleeping well at night anymore. You're crabbing at everybody because you're not sleeping. You're stress eating.
Yes.
You don't feel like you have enough hours in the day because you're just running. You're burned out, but you don't even realize you're burned out because you're on autopilot. And
Uh-huh.
your periods are going crazy. You're you're might be in the middle of a work meeting and all of a sudden you break out into a sweat and you don't know why.
Uh-huh.
Just all these things that start happening with your body as your body transitions into menopause and you're dealing with all of this, and then your partner still has the same expectations, if you know what I mean.
Yes.
Right?
Yeah. In all fronts.
They still need you to manage the household. They still
Yes.
need you to help with the finances. They still want you to put out on a regular basis,
Uh-huh.
right? And then you're just like, all of,
Yeah.
sex is the last thing that you're thinking about.
Mm-hmm. Yeah, because you get to that point where something has to give, right? Like,
Right.
cannot continue to be all things to all people in this body that is going through the same type of transition that we did during puberty. The
Exactly.
renovation happening in our body is just as extreme as it was then.
Mhm.
And now we are the ministers of infrastructure for our lives,
I
where
actually
we
think it's
were not then.
worse.
Yes.
I don't
Yeah.
remember this hormonal chaos when I was going through puberty. Like, the only thing I remember about puberty is that I was a little crabby sometimes and my period just showed up. Bang. Like, I don't
Yeah.
really remember anything else.
For me, I think it was a little more traumatic because I got my period in grade 6.
Mhm.
So, oh, you
Same.
did too. Okay.
I
So
was
I
11.
felt like a bit of an alien in my world. Also, nobody knows because I sit down all the time, but I'm 5'10", and I have been 5'10" since grade 6.
Mm,
So I had
were
this
you going to
like
school with pads that thick?
yes. Oh, the like late 80s, early 90s products. So yeah. Ah, yeah.
Tell
So
me you're Gen X without telling me you're Gen X.
yeah, absolutely.
My mom
Yeah.
insisted she wasn't buying those new thin ones because they're not going to catch anything. It was these big, huge things like that in the school bag.
Yes. Not discreet. Not discreet. But I felt a little bit hit by a truck because like everything happened to me all at the same time. And I had Osgood's flatters in my knee because my tendons and bones and ligaments grew so quickly. So I had like this excruciating pain in my knee, and I was a foot taller than all the boys in my class. School dances were real awkward.
Strange. Yep. I
Yeah.
remember that. I'm 5'7" and I pretty much hit 5'7" by grade 6 too. And it was
Okay.
taller than everybody, bigger than
Yeah.
everybody. I was the kid in the front row in the center, in the back row in the center.
Yes,
Yeah.
back row center, always. I see you. I feel you. Yes, yeah. So all that to say, I'm relating back to that girl now more than I have in a really long time. Like
Mhm.
thinking about what her experience was as this shift starts to happen again. Like as we were talking, when I said I should have hit record, I was saying I'm perimenopausal, so I still menstruate. I'm at the end of my this month's cycle, although I can't even say this month anymore because I'm now at the stage where things are really unpredictable. Like I used to be every 24 days on the dot, and now sometimes it's 21, or sometimes it's 50, or sometimes it's 30. I was getting blood work where the instructions were you must get this blood work on day 19 or 20 of your cycle. And I was like, good luck.
Good luck. Yeah.
Good luck. I will do my damned best, but I cannot guarantee
And
you
that's why they
anything.
say testing your hormones in menopause is like almost like redundant, right?
Yes.
So I have recently purchased a Mira. I don't know if you ever heard of it.
Yeah.
And I'm now like trying to just figure out where things are at. Now, for months and months and months, I've had an Aura ring, that was doing these little blips with my body temperature about
Okay.
every 45, which now it's spread out 60-ish days. And I figured out after a few months that this blip that goes up like this and down like this, I'm like, that's a luteal phase.
Yeah.
Oh
Mm,
my gosh, I'm still cycling in there, right? Because I don't get a
yeah.
period.
Yeah.
So I'm like, okay, I guess I'm not menopausal yet. I'm not postmenopause. I'm peri.
Hmm.
So if I'm still doing that, I've got to be peri.
Yeah, and this brings thank you for that because this brings us back to I wanted to talk about a little bit more about your experience with the hysterectomy and GSM because this is a conversation I hear a lot. So women will say to me, "I had a hysterectomy, I don't have a uterus, but my doctor said I should be fine, but I'm having these symptoms, but it can't
Okay.
be because everybody said it was fine. I still have my ovaries." No, not at all. The point you made about ovary experiencing blood loss and in my research and training any kind of abdominal injury like that will absolutely have an impact on all of our reproductive function. So
Absolutely.
if you can talk about that a little bit more, I think that would be really helpful for folks.
So if you ever looked at the anatomy of our reproductive system as women, right? It's hard to explain out of my head, but I'll try. So we have the two little
Mhm.
ovaries on the side, right? And then, in the middle, we've got like the vaginal canal, they often show the cervix is kind of sitting in the middle of it. Then you got this like balloon pear-shaped organ, which is our uterus. And
Mhm.
actually, it's kind of really bulby at the top. And then from that, you got these two little tubes, one on each side, that are just kind of coming out, right, with little fingers at the end. That's our fallopian tubes. And then our ovaries are just kind of floating there. They're attached, but not really attached, right?
Right.
They're kind of just there because it's the fingers of the fallopian tube that when you ovulate, it's the fingers of the fallopian tube that actually pulls that egg into the fallopian tube. So that's blood vessel central thing that's happening there, right?
Yeah.
There's a lot of blood flow that goes to our pelvis. So when you go in and do a hysterectomy, and I know my particular surgery was actually quite traumatic. My doctor told me I had a lot of scar tissue from previous cesarean sections because all of my kids, I have three kids, and they were all delivered by cesarean.
Yeah, me too.
So
Well, two.
from having yeah, so from having the three cesarean sections, I had a lot of scar tissue in there. And because of the disease process of the adenomyosis, it created more scar tissue. So he really tried to do it through laparoscopic surgery with minimal openings to try and get this out. And it turned out because of all of that scar tissue, he ended up having to like really cut the uterus up, is what he said, to
Ugh.
extract it. Yeah, isn't that
Yeah.
awful? And
Yeah.
I was in surgery a lot longer than I should have been. So, and in the meantime, they also ended up nicking my bladder.
Right.
So he said that he really had to cut things away and like pull, and like it was very traumatic, and I actually had like some complications after.
Yeah.
But that whole process of removing the tubes especially, because they're right beside the ovary, right? So he removed the tubes, he removed the uterus, took the cervix, and the blood flow that goes to those organs in itself, that's gone too. So nobody really knows how much of the blood supply to the ovary, is actually healthy, right? Which is going to affect the viability of how those ovaries work, right? And if you're having a hysterectomy, my mind tells me that there's a pathological reason why you're needing to have that uterus out, right? So
Yeah.
they're going to be pulling and, taking things out, and may need to take more things out that they don't really need to. And then at the same time, everything kind of shifts again in the pelvis because you no longer have that uterine structure that's holding things up, like your bladder.
Yeah.
So you do end up losing a lot of your blood supply from that surgery alone to your ovary. The most I was told was, yeah, you're still probably going to go through natural menopause, but you might go through menopause maybe 2 or 3 years earlier. And he goes, that's just because, you don't have the structures there. What did he say? You don't have the structures there anymore to support the ovary. He never said blood supply, but that's probably what he should have said.
Right. Yeah.
But for me, a lot of those symptoms showed up immediately, like the vaginal dryness, the urinary like urgency, the bladder spasms, the like just that whole mess that happened after. That
Uh-huh.
was immediate for me. And the other thing I had immediate after surgery was mood change. So those were the two things that really stood out for me right after I had my hysterectomy. So you can't really tell me that you're just going to be fine if if we just leave your ovaries. I think that's a huge misconception. And I really feel that gynecologists need to do a bit of a better job at preparing women, not just the ones who are losing their ovaries, but the ones that you're leaving one or two ovaries, really explaining to them that it's a possibility that you may have premature ovarian failure or go into perimenopause years sooner than, your counterparts who still have their reproductive system intact.
Yeah, absolutely. Thank you for sharing your story. And there are many problems with our medical system. One of them,
That's a different podcast.
yeah, I know we don't have time for for that today. What I wanted to highlight was the issue with having all of these specialists who focus on one aspect of the body
Mhm.
means that we are not looking at the body as a system, and everything that happens during perimenopause and menopause happens to the entire
Your
organism,
body.
to the entire system. So when we have specialists who are just looking at this microcosm of your body, they aren't trained. Right. We try to avoid blame and shame. It's no one's fault
Yep.
in particular. And the research exists now that needs to be learned and needs to be known. So yeah, we need to
A
make
lot of
sure.
them are like, "Oh, well, you can't have babies anymore, and it's just hot flashes," right?
Yes.
A lot of doctors won't even treat you unless you say, "I have hot flash." Unless you have hot flashes, they don't want to treat, right? And
Yeah.
that's
It's so problematic. And we need to be coming at this from the perspective of giving women the knowledge they need to pay attention to their own bodies and know, okay, this is what's happening.
Mhm,
So this comment of like, oh, you still have your ovaries, so everything is fine. One, that may be true for someone,
mhm.
but it 100% is not going to be true for 100% of the people.
Exactly.
So let's give women the knowledge that they need, especially when it comes to GSM, the genitoury. I'm so glad I'm not the only person who has a hard time
Genital
saying
urinary
urinary syndrome. I trip over that part
But
every time. It's just our tongues just aren't meant to make those sounds
yeah,
together.
I know. I know.
But GSM is so important, and when women are talking to me, I hear the symptoms of it all the time, particularly if they've had hysterectomies, if they had cancer treatments for breast cancer, cervical cancer, uterine cancer, any of those things. If they've had cancer treatments, they talk about GSM symptoms.
And GSM isn't just like the dryness.
No.
It's so much more than that. It's like the urinary tract infections that start to happen, right? The vagina anatomically starts to change. It
Mhm.
gets shorter, it gets thinner, the walls of the vagina get thinner, and in some cases the labia minora actually kind of retracts a little bit because of all of that atrophy that's happening. And that's why some women are more susceptible to UTIs or urinary tract infections because they no longer have that protective covering to protect the urethra, right? So they're constantly getting infections because I mean we do our business down there, right? And
Mhm.
it doesn't matter how clean you are, you're still sitting in it all day and like
Yeah.
the bacteria moves around.
And as that tissue thins and becomes more brittle, there's more opportunity and places for
Absolutely.
bacteria to cross into the bloodstream.
Yep, you get tearing, the itching, the burning, painful sex, even loss of sensation in the clitoris happens. Like it's just a mess. And
Yeah.
then, in more severe people, they start to experience like the loss of the muscle
Yes.
in the pelvis. So then that creates things like uterine prolapse,
Uh-huh.
rectal prolapse, bladder prolapse. So there's just so many things that need to be addressed in the pelvis of a woman in perimenopause. And there's just
Yeah.
still, again, not enough education about it.
Absolutely. Especially because we know now, and this is going to lead me into the next part of our conversation I want to have, is that a big part of the solution for all of these is vaginal estrogen cream.
Mm-hmm.
And as we are speaking in the United States, there is a team of healthcare practitioners, predominantly female physicians, who have been leading a lot. They're not the only ones, but they have been leading the work around advocacy in menopause and perimenopause. They are currently advocating to the FDA about removing the warning labels
Mm-hmm.
that are on estrogen products. And I really want to have this conversation with you. Yes, it's happening in the US, but what happens in the US has ripple effects for us. And in
Mm-hmm.
this case, it would be very positive ripple effects for us.
Absolutely.
What we need to do in Canada to make sure that those ripple effects happen here. And the very nuanced conversation that needs to happen in the rage machine that is
Yes.
happening around menopause and
Yes.
perimenopause. So let's start with the FDA advocacy work and why that box was there and why it needs to go.
Yeah. So on it, they call it the black box warning. So they view hormones as a class one carcinogen. We all know that the study that was done in 2002, the Women's Health Initiative, wasn't exactly reflective of
Mhm.
women taking HRT, hormone replacement therapy. That study used women who were like 20 years past their last menstrual period. They already had cardiovascular issues that have set in. They weren't, the ideal candidates for a study like that, right? And so that's where they saw the increase of breast cancer, they saw the increase of strokes, and then immediately they shut the study down. Now we know from current research that research actually wasn't done properly, and they kind of jumped the gun on that. Fortunately, we have an entire generation of women who are afraid to take hormones. They're afraid to take estrogen, something that our body naturally makes. They're afraid of it, and
Yeah.
they've been told by their family physicians that it's going to cause cancer. So there was like, I think, an 80% drop in women who came off their hormone replacement therapy at that time, and the
Uh-huh.
doctors have stopped prescribing it. And I'll just preface this before I go any further about vaginal estrogen. I saw my family doctor to get onto HRT, which was a struggle,
Mhm.
but I did end up on a transdermal form of estradiol. But a few months ago, I went back to him because I was struggling so much with GSM symptoms. And I said to him, I really need something, vaginally as well. Sex is uncomfortable. I'm, really, really dry to the point where it actually hurts. And it's itch and it's just not comfortable for me down there. And as a 45-year-old woman, this just should not be something that I need to wrestle with, right?
Absolutely. Yeah.
I shouldn't have to suffer through this. So do you know what he wanted to do? He's like, okay, I'll give you the vaginal estrogen, but I'm going to take you off your estrogel.
Right.
I'm like,
Local.
well,
It's
well,
local.
yeah, I'm
That
like,
means it's not
no,
systemic.
I can be on vaginal estrogen at the same time as my systemic one. And the
Yes.
reason is because vaginal estrogen is local. It's only going to be localized to those regions of my
Uh-huh.
body where I apply it. It is
Yep.
not, it is the studies and the research show that vaginal estrogen is like negligible where it increases serum amounts of estrogen in the bloodstream. So be like, but it just goes to show that our doctors here are not well versed in that. So I had to advocate for myself and go elsewhere.
Yes. Uh-huh.
To get what I need. But that being said, there's this black box label warning, especially on vaginal estrogen products. And because of this warning, it really deters women from wanting to use it, right? We're more willing to suffer in silence than to replace the hormones that are actually going to keep us well through our lifetime. The research, there's lots and lots of research now out there showing that vaginal estrogen is safe for like 99% of women out there. You can take it. They're now even starting to do research on women who've had breast cancer to see if there's any issues with recurrence of disease or anything like that. And right now, the studies are showing that it's very promising, that even women who have had breast cancer and breast cancer treatment, they can still take the vaginal estrogen to help those GSM symptoms. Because for women who either have had a radical hysterectomy where everything's gone, or they've had cancer treatment that has completely shut down their ovarian function, those menopausal symptoms that they experience is like 100 times worse. It comes on fast, it comes on furious, and they are far more uncomfortable than, say, you or I, who are naturally going through the menopause process. They don't gradually lose their hormones, they have lost them immediately. So the shock to the body in that process is far more severe, and there's no relief for them. So by
Absolutely.
removing this black label warning, they're hoping that more women will be more comfortable asking their providers for it, but it also will help the providers to start stepping away from wanting to prescribe this for their patients. So
Absolutely.
I'm hoping that this becomes really successful and that they can actually remove it and really educate doctors and practitioners out there
Yeah.
with the current research.
Absolutely. Dr. Rachel Rubin, who
Mhm.
is a urologist, she is part of this team who's doing this advocacy. She does a really great job of sharing her own story when her mother was very ill in ICU, had a UTI, and
But,
she, as a physician, as a urologist,
but,
said to the medical team for her mom, she needs vaginal estrogen. And they said, no, it will cause cancer. And she said,
and stroke. Yeah, they
yeah,
thought
and stroke and blood clots, and she had to advocate to them, she had to bring in the data, she had to teach them and show them. So then
mhm,
they said, okay, fine, we'll prescribe it. She had to teach them how to prescribe it, what the dosage would be. Then it went to the pharmacy, and the pharmacy refused to dispense it because this black box came up and said it can causes cancer, stroke, blood clots. And so she then had to go to the pharmacy and instruct the pharmacist around what was around why this box is an issue, why her mother needed this estrogen cream, why it was safe. Finally, they dispensed it. The prescription came to the ICU, and the nurses didn't know how to administer it. So then she had to teach the nurses how to administer that cream to her mother.
absolutely wild.
And in the midst of this, and for her, it's her profession, but it's also
Mhm,
her mother. And that's what we see happening. We're in the midst of these crises situations.
mhm.
And the data is showing us now more and more that more and more women are dying of sepsis from UTIs.
Well, I saw it when I worked in the hospitals. So
Yeah.
when I worked in the hospital bedside and I did like a stint on the internal medicine unit, I would say quite a few of our admissions that would come in would be a urosepsis. And, I don't know if you've ever seen a woman with urosepsis, but they often are accompanied by some form of really horrible delirium, like
Uh,
really bad delirium, fever. Yeah, a lot of them do end up in ICU because the infection has gone systemic. And in elderly people, that infection, that bladder infection, is going to go systemic real quick. You often will know if somebody has chronic UTIs because they all of a sudden get a personality change. First,
uh-huh.
the delirium sets in, so then to test the urine. Oh yeah, there it is. But after several urinary tract infections, the antibiotics that they use for it stop working after a while, right? You become immune to it. You become like, your body develops a resistance. The bacteria that grow there develop a resistance. So, like in some people, it was very difficult to treat. And then because they kept going into hospital, some of them ended up with nosocomial infections at the same time. So they might end up with something like called ESBL, which is resistant to certain antibiotics.
Because we're
MRSA, another one that's resistant to methicillin. So there's just so many things that can happen along the way. And these are things that can kill you. These are
yeah.
things that can kill you, right? So it's really, I mean, it sounds so simple just to give somebody some vaginal estrogen.
Right? Absolutely. Because when we're treating with antibiotics, it's not getting to the root cause.
Mm-mm.
It's only covering up the symptom, and that's why we develop resistance. That's why all of these things happen, because we're not at, and the root cause and the treatment for it is actually so simple. And similarly, like when I'm facilitating sessions, there is never a session where I don't have someone say, I lost my grandmother to a UTI. I lost my whoever to a UTI. Oh, I'm experiencing this right now. So
Uh-huh.
this information is incredibly important.
Uh-huh.
And in the midst of all of this advocacy that is happening, there also is all of this controversy swirling. And I wanted to share one of my own reflections about it because it's really easy to get pulled into. So I was saying to you before we started recording, as I was coming on, I was looking at social media in my world, my social media, and I'm sure yours are as well. My feeds are just all menopause. It's
Menopause.
all menopause,
Yeah.
menopause, doctors, like all of the folks.
Yeah.
That's my
Yeah.
feed.
Everyone's there.
Yeah. So Dr. Kelly Casperson, who is doing really powerful work,
Uh-huh.
has this cartoon of herself as a superhero holding a tube of testosterone.
I saw that this morning.
And my initial reaction was like, "Ooh, why did you do that?"
Is this a toss on that Donald Trump one that was out last week?
Right. And if it's that, like that's kind of smart and I love it.
It's kind of funny.
Absolutely. And I caught myself having that initial rage response, which is what social media is so well known for. But what I did was stop and think, you know what? That is her lane.
Uh-huh.
That is what she's doing. She and Dr. Rachel Rubin are the two female urologists. I mean, that may not be exclusive. There may be other humans in the world doing this work, but they are
They're the ones at the forefront anyways, right?
exactly,
Yeah.
yes, who have the platform to be loud and get this message out there. And it's so important. And if that is a way that they are able to get the message out there, then that's their role in this story.
Yeah.
And I don't need to have rage or judge them for that. But what we need to be doing, I mean, we all, especially as women who are strong, powerful leaders, we face enough shit from everything else.
Uh-huh.
What I wish more than anything is that in our community, we could just
Yep. And
cheer you
pull
on.
in each other. And
Yes.
it's not our lane, right? So I hate bringing this up, but I'm going to anyways because it drives
Yeah.
me nuts. I see a lot of, and I can talk from both sides because I'm a personal trainer too. But I see people, trainers online who are well known or out there or have a lot of following, totally ripping Dr. Mary Claire Haver. And they're calling her a grifter. And that sort of started from another physician who has a kind of a rift against her as well and also calls her a grifter. The backstory is Mary Claire Haver, when she started doing, and I met her last year. She's a really
Me
sweet
too.
lady and just she didn't scream grift to me, but whatever. Anyways, she actually went and got herself educated in science of nutrition, right? So she has this additional background. And when she started her menopause clinic and started to treat only menopausal women, she was seeing nutrition gaps. So she went and did, formulated this line of supplements that she, suggests to her clients. And then now they're out there for anyone who wants to use them. I wouldn't necessarily say that's a grift, right? She's using that as part of her treatment plan. She recognizes and acknowledges that there are gaps in nutrition that happen. And when we talk about nutrition and menopause, which is another podcast,
Yeah.
women get caught in these diet culture things. They want to lose all the weight, but they don't know how to do it. They're restricting, they're cutting, they're resorting to Ozempic, which I have a really scary story about. But it's just really it's really sad that she's being labeled like this when you can clearly see that she is actually doing everything she can to advocate for women, right? And it doesn't
Yes.
really matter that she has a supplement line. Who cares? That's
Absolutely.
her way of helping women.
Yes.
Go for it. Good for you. Now they're on her about, I saw a post yesterday, they're on her about the whole weighted vest thing. And I did a post about weighted vests a couple of weeks ago, whether or not they're scientific and whether to use it. if you want to use a weighted vest when you go walking or whatever for that additional like weight, sure, go for it. Is there a whole lot of research that says, yeah, it's going to make your bones really, really strong? Not really, right? So, yeah, there's a bit of a trend with it, and you see that online. But if she's choosing to use a weighted vest and she's using it while she's working out, she knows she's not a personal trainer, but she was absolutely ripped. And I was really disappointed at looking at some of the comments in there and seeing some of the people that were commenting, because a lot of them are pretty big in the wellness world and on Instagram, have big followings. And they were just making all these comments. She needs to stay in her lane. She needs to do this. She has this linked in her Amazon store. I think there's a lot of things that people are missing the buck on in
Yes.
this menopause space, and they're focusing on tearing down the people who are at the forefront doing the work. And I'm not going to mention any names, but there are people out there, there are doctors out there who may have been like big pioneers and stuff in starting the menopause conversation, but where are they?
Yeah,
Right?
absolutely.
Why
Yes.
haven't you called up instead of like name calling these people grifters and name calling them and pointing them out for their poor form and for their use of a weighted vest and their Amazon storefront? Where are you? Why are you not linking up with these people? Why are you not having conversations with these people who are actually willing to be at the forefront to educate? Where are you? Right?
Yes.
You're over here creating drama and like, picking at the individuals who I actually feel are really heart led and really trying to make a difference for women in midlife.
Yes. Absolutely.
All I see is you over here making noise, and I have no respect for you.
Yeah. And it's just, and so,
Regardless of the work that you've done and that your science, like you're scientifically based and you work on the science, that's fantastic. Please keep doing that, because I don't like pseudoscience. Please don't do that. Please keep doing that. But how about you start helping these women also spread the message instead of tearing them down?
absolutely. And it could be a really powerful time of transformation in the way we see ourselves in the world, because I think this comes from a couple of things. So one, if Mary Claire Haver were a man, this narrative would be totally different. It would be,
100%.
she's so smart. Look at the way
Mm,
she's leveraging all of these
mm,
different areas. Like,
mhm.
she's a business genius.
Yep.
Right. So, one, there's that. Two, as women, we come from, well, I mean, all of us come from a culture of scarcity.
Mhm.
And as women, that scarcity gets even more intense, and that there's not as many seats at the table. And so when we get a seat at the table, we become very protective of that seat because we feel like we are there, we are representing, we're doing the work. And then when other people try to come to the table, it feels like an attack
Mhm.
because of this mentality of scarcity.
You are so I never even thought of it like that.
Yeah. Well, I mean, I experienced it in my
Yeah.
education career, so I wish I weren't talking from personal experience, but I am. And what we could be doing is actually transforming that and saying, we reject scarcity. There is enough room for all of us here. So I'm going to push my chair back and over to the side, and we're going to make this table as big as it needs to
It
be.
is a big planet,
It is a
and you
big
can't do
planet
it all.
with so much work to do. 50%
Yeah.
of the planet are women who will all have this experience in one way or another.
Mhm.
And the other half of that might be gender fluid or gender non binary, who are going to have these experiences as well in a variety of different ways.
Trans. Yeah.
Trans people, I've had, yeah, absolutely, conversations with folks who are trans who were going from female to male and went into perimenopause when their estrogen levels declined, and no one is talking about that.
Mhm.
There's so much. And then the men who are in the world are also working with, who are partners of, who are children of, who are, everybody is impacted
I don't know
by
about
this.
you, but I'm telling my girls about it right now, and they're only 16 and 18 years old. Like, hey, this isn't going to be forever. You're going to turn into mom.
Yes, and you when you go into this with this information, you will be so much better able to, one, care for yourself, and hopefully they won't need to advocate as much, because I remain hopeful that we are doing that work and are going to make this change. And if there's anything I could say to those women who are out there who are leading the charge, it's, one, make space for each other.
Mhm.
Two, make space for right. So there are, yes, we need big people in the world, but then there's also people like us
Yeah.
who are like on the ground doing work, who also need some space to represent
And I
and to share
remember
our
having
perspectives.
I actually had a small little conversation with Mary Claire Haver when I met her last year.
Yeah.
And she asked me, she goes, "What do you do?" And I said, I'm a registered nurse, so I can't prescribe. I don't have prescribing authority. But as a nurse and as a personal trainer, I can educate. And that's what I do, and that's what I focused on. And I can do health teaching. That
Yes.
is in my scope of practice. That is in my lane. So I have taken what I know as a nurse. I've taken what I've known as a personal trainer. I've taken all the other extra things that I have learned and put that all together. And now I educate women in the community. And
Yes.
that is what I do. And she's like, "Oh my God, that's like brilliant." She goes, "I really wish we had more people like that." She wasn't even aware that people did things like, she goes, "I know that there's like wellness coaches and stuff that are on the menopause train." But she's like, "I didn't even realize that what you do is could be a thing."
Yeah.
And I'm like, "Absolutely."
And
It
it's
could be a
really
thing. And
important.
your skills as a teacher and as a nurse or whatever the case may be, like if you come from those types of professions, those are transferable skills. You can
Absolutely.
totally like educate yourself further, get what you need to get to make yourself credible, and go out there and educate. I mean, I live in Waterloo Region. There's 800,000 people that live here. I have no intentions of going to Toronto, London, Windsor. Like, I'm sure there's got to be like wellness people all over the place that can do the same thing that I can, because Waterloo Regional keeps me busy as it is.
Yeah. Me, because I'm in Thames Valley.
Right, exactly.
I'm in London.
So, so when people are getting upset about other people doing their thing, we're all in this space together. We all have a common goal. I don't understand why we're going on social media and ripping it all apart and creating these barriers and creating these like, well, she's a grifter, she's a this, she's a that, and like, it's like she's not a grifter. Yes, okay, so she makes money from it,
Uh-huh.
but it's part of her therapy and what she does for patients. The
Yes.
fact that it's available to the general public, okay, so it is. That
Yeah.
doesn't make her a grifter.
It doesn't. And it
It's
also gets
information.
it's information, and it also gets to the broader conversation. So the other thing I worry about is this. Menopause hormone therapy is important. It's an important part of the conversation. There's advocacy and research that needs to continue. There's like it's essential. And it is not the only
No,
part of the conversation.
no,
And
it's not.
this is where I get really worried, because in this world right now, it is feeling like that is the only conversation. And I keep saying, yes, and we cannot come to this conversation without also talking about nutrition, movement,
Yeah.
stress management, and
Mhm,
sleep.
mhm.
Those lifestyle components are just as essential as the menopause hormone therapy. And
Mhm.
it's not an either or, it is a both and.
And let's expand that even more to coping in the workplace,
Yes.
advocating for yourself at your family doctor, like advocating for yourself in general, how it affects your relationships,
Yes.
sexual health, like all of that. Like,
And the identity shifts that
yeah.
we experience at this time.
Mm,
Going into perimenopause and menopause, yes, it has physical ramifications. It also has identity ramifications. How
mhm.
are we seeing ourselves in the world when there hasn't been narrative about what it looks like to be a vibrant woman going through this phase? Our parenting roles are
Mhm,
changing.
mhm.
When I don't know about you, but my world was being an educator and a mother. That was what I had like structured my whole world around being.
It's your identity, right? Like,
Absolutely.
you go to school, you get your degree, you become a teacher, you become a nurse, you do that for X amount of years, and then, like, you hit your 40s and stuff, and you're just like, "Oh." I don't even know if I can do this anymore.
Yeah.
Like, how did women stay on the hospital floor for 35 years? There were nurses I worked with that literally did not retire until almost 40 years.
Yeah.
And then they would take their pension and come back casual. And they're like pushing 70. And I'm like, what are you doing? Like, oh my God. When I was working in the hospital, I was on the countdown to 55. Like, 55 years old, I'm out of here. I'm not
Yes.
staying. I've been in the pension for 30 years at this point. I am done.
Yeah. Same. Same. But then I got to the point where I realized I didn't want to wish away a decade of my life. And that's why that was, I mean, one of many reasons why I ended up leaving education, but that was part of it. I wanted to stop wishing away the years because my mom died when she was 52 years old.
Mhm.
And
My dad died 6 months after he retired.
yeah, and we see that in helping professions.
Yeah.
That is what happens. People retire and they die
Mhm.
for a whole lot of reasons.
Mhm.
So there's all of this giant conversation that is so important to be had. So just as we're wrapping up here, because you and I could talk for what a million years,
Probably.
and I think we're going to need to schedule
Probably.
some more
I think
episodes.
because you think like me. We think like each other, which is fantastic. I love
Yeah.
meeting people like you.
I really appreciate you and your time today. And I just want to make sure listeners, as you are leaving this from this conversation, just take that, whatever you are seeing, reading, think about it through the big lens and think about it through all of the perspectives. And if you are confused and unsure, reach out to people like Amanda. Reach out to people like me who can have these big, nuanced conversations with you and then help you filter that information to what is meaningful and important for you. Because you are not going to sort it out with your group of friends. I hate to tell
No.
you that,
And your
but you're not.
experience isn't going to be the same. Your
No.
experience isn't going to be the same. What you need emotionally, mentally, physically isn't going to be the same. What works for one person doesn't work for the other. I was just, before we hit record, you were talking about your progesterone, and I was like,
Yeah.
I just had a conversation with my NP. I don't think progesterone is right for me right now, for varying factors, right? So, like,
Yeah.
even your treatment plan isn't going to be the same. It is so different for everybody. It's not cookie cutter. And this is what anyone I meet who is interested in coaching, like individual coaching, I always say to them, okay, like, I always do like a full like intake. It
Yes.
just gives me an idea of what their gynecological history is, what their physical history is, what works for them in the past, what hasn't, their fitness level, like everything. Because that person isn't going to respond the same way as someone else would. And it also gauges what kind of education that they need, what the gaps are, and so on and so forth. And then, help them with their nutrition in that way and their fitness planning that way. And I do a lot of work around the wellness piece. And then when it comes to the pieces around, HRT, if they're interested in that kind of thing, they're given the education and then, all right, take this information to your doctor. Right.
Yes.
So it's so individual for so many, like for every woman. It's
Absolutely.
can't even think of anything that's even more individualized than that.
No. It's yeah. It's very true.
Like
It's
it's
why it's why treating us is so complicated, and that's not an excuse, right?
Mhm.
It should be a call to action
Yeah.
actually around why personalized medicine is so important. And so the only other thing I really want to leave people with from this conversation is if you hear someone saying to you, this is the way and the only way, run.
Mhm.
That is your signal
Mhm.
that person has a very narrow perspective,
And
right?
it's a silo.
Yeah, absolutely. So you want to make sure you are hearing from someone who says, here is all of the information. Let's tailor what works for you. And
Mhm.
it's not going to be one way, and it's not going to be
No,
one thing, and it's not going to be tomorrow, the next day, or in 3 weeks.
no,
Yeah,
no. And even as you're working with somebody or that person's working through things, there might be things that shift and change, and then you have to pivot again. Pivot
absolutely.
is my favorite word.
Yeah.
I'm always pivoting, okay, well, that's not working anymore. Let's try this or let's adjust this or like you're always pivoting. So that's how perimenopause is, right? Our hormones are all over the place, everything's shifting, changing, our brains are adjusting. You have one day where you feel like you're on top of the world and you can do all these things. And then the
Mhm.
next day you're just like, I can't remember where my keys are.
So that's the truth.
It's just so different even day by day. So I'm
Absolutely.
always pivoting.
Thank you so much for your time and your wisdom and your generosity today, Amanda. This conversation has been medicine for my soul, so thank you.
Me too. I'm kind of dying to have a bit of a conversation like this. And it's really funny because last night, I don't know if you saw the video on Instagram, but I did like a little short rant about people in the menopause space that need to move over and not attack people. And I kind of did a little rant like that in that video because I was doing an unboxing
Okay.
for this
I
menopause.
missed it. I'll have to go check it
Okay,
out.
yeah. She Bang Menopause, they came out with subscription boxes
Okay.
for people in menopause. So they gifted one to me and I opened it on Instagram. And then at the same time, I was like, there's even room for people like this in the menopause space. They're just out there doing their thing, trying to make women feel good. They're not grifting. Yeah, they're making money from it, but there's nothing wrong with making money. Why is this so terrible? Right?
Absolutely. And it's not like so we are skilled. We have
Exactly.
invested in education. We have invested in training. We have poured a lot of resources into
Right.
creating these individual knowledge sets that we have. So
Exactly.
absolutely. We
Exactly. I'm like, look at
we
these
deserve to
women
be paid for
who just
that.
thought of this idea. They want to make women feel good. The box was all about self-care, taking a pause is what they called it. And it had just all these things in it to make you feel good. I'm like, this is what women do. This is what women do when they're supporting other women,
Yes.
right? And this is what we need to focus on. So yeah.
Absolutely.
So this kind of fit right into the rest of that rant. It was fantastic. Thank you.
Until next time, thank you so much.